Hello everyone, I am Dr. Akhil Tawari, consultant spine surgeon. I welcome you all to another discussion in our pursuit of spreading spine education. Today I will be discussing on a dangerous condition if not treated properly, and that condition is spinal infections or infection in the spine. So just as we have different organs of the body which can be affected by infections, including the lungs, kidney or the brain, similarly, we can also have infections in our spine. Spine infections can affect either the spinal bones or the vertebra. They can also affect the disc, or they can affect the spinal cord and the nerves along with the surrounding tissues. So what are the symptoms that the patients present to us? The patients usually start getting severe neck pain or back pain to the extent that even their sleep can get disturbed. Most of the patients who come to us have tried some of the other painkillers, and they typically say that the pain doesn't vanish even after taking strong painkillers. In late cases, if the infection spreads around the spinal cord, then the patients can have numbness or weakness in their legs. They can have difficulty in walking. They can lose control of their bowel and bladder. In rare cases, the infection can spread throughout their body and can have serious consequences. So who gets these spinal infections? Well, pretty much the spinal infections can affect across all age group, including kids, adolescents, young adults and old age people. But there are some host factors which can make one person more susceptible to getting the infections. So if the patient has diabetes, if they have severe comorbidities including obesity, if they are taking drugs for cancer treatment, or if they stay in a very crowded place with low ventilation, then these are the patients we have seen who are more prone to developing spine infections. Also, since the infections in the spine can spread if the other organs in the body are affected, we have seen that patients who have infective focus in their teeth, in their urinary tract, in their lungs, the infection can spread through the bloodstream and affect the spine and the spinal cord. So what do we do? So once the patient present to us, we usually like to first examine and see how severe the pain is and what is the neurological status. We usually like to investigate the patient. The investigations are the blood parameters which tell us about the value of infection with regards to the WBC count, that is the white blood cells, which helps to fight infection. And there are some surrogate markers for infection including the CRP and the ESR. At the same time, we also like to do imaging studies. Although we start with X-rays, usually we like to get an MRI scan done. MRI is a very powerful tool. It not only helps us to come to a diagnosis, but also helps us to know how bad the condition is. There are certain infections in which multiple areas of the spine can be involved, and they can be easily picked up on the MRI scan. Now, what are the common organisms that can cause infection? So there are a number of microorganisms which can result into spine infections. However, over the years, we have found that there are certain kinds of bacteria such as Staphylococcus or E. coli which are more prone to developing spine infections. Also in our country, India, a major cause of spinal infection is also spinal tuberculosis. Spinal tuberculosis is very, very much prevalent and can be considered to be the leading cause of spinal infections in India. So how do we treat them? So just as any other infection in the body which requires antibiotics, spinal infections in majority of the cases are managed with antibiotics. The crucial way to understand which antibiotic would work would essentially mean that we have to find what organism is responsible for causing the infection. So we usually like to do a biopsy, that is sticking in a needle inside the spinal canal or the spinal disc and taking a tissue sample and sending it to isolate the organism. Once we have the organism, then half the battle is won. If detected early, majority of the patients can be managed very well on IV antibiotics along with pain control. Now, there are some instances in which the patients, by the time they present to us, the infection is widespread, the spine has become unstable, or the pus is so much that the patient is having neurological issues. In such cases, we usually like to operate. The operation would entail that freeing the pus, freeing the spinal cord, and if the spine has become unstable, putting in screws and rods to support the spine. And of course, it is easier to understand that when we are proposing operation to the patient, then that would entail that there is complication that has happened, and the surgery would only be to cover the complication, but the primary treatment for an infection would still be using antibiotics. How much antibiotics, what duration of antibiotics, that is dependent on involvement of the infectious disease specialist, and they guide us with what antibiotics and for how long the patient has to be on. But for spinal tuberculosis, usually the treatment is anytime between 1 year to 1.5 years. Apart from the antibiotics, we also like the patients to have good hygiene, good nutrition, and that would really help to increase the immunity and ultimate controlling the infection. So the takeaway point from this is, if you are having a low immunity, if you continue to get back pain or leg pain, especially the back pain being so severe that your sleep is disturbed, it is important that we try to find the diagnosis of infection and treat it with antibiotics rather than waiting on it, which would then require surgery. Thank you.